If you've been told your nerve symptoms are unexplained, idiopathic, or that you just have to learn to live with them, stop scrolling for a second, because that numbness, tingling, burning, and weird sensations, they didn't appear out of nowhere. Here's something important that often gets missed. Normal tests don't always mean normal nerve function. Your nerve pain isn't random, it's patterned, and it follows a story your body's been trying to tell you for a long time. The reason it gets missed has nothing to do with pain being all in your head and everything to do how the nervous system is actually evaluated. And once you see what's really being overlooked, the way you approach healing can completely change. Welcome back, Health Warriors. Dr. C here. Now, let's talk about how you got stuck with what we call a junk diagnosis. Often, when doctors don't see a clear structural cause on imaging or blood work, symptoms get placed into a category that sounds clinical, even important, but it's actually very vague. They're slapped with a diagnosis of idiopathic neuropathy. In conventional medicine, idiopathic simply means we don't know the cause. Now, it does not mean there is no cause, which is one of the main reasons nerve conditions are missed. Because when nerve symptoms are framed as random or unexplained, the nervous system is treated as if it malfunctioned out of nowhere, when in reality, the body almost never works that way. Your nervous system is highly adaptive. It responds to patterns, it reacts to the environment, and it remembers stress. What we see again and again in people with neuropathy or chronic nerve symptoms is not chaos, but accumulation. Small stressors layered over time, things like metabolic strain, inflammation that never fully resolved, daily low-level toxin exposure, chronic blood sugar instability, nutrient depletion, infections the body never fully cleared, long-standing nervous system overload. None of these alone may be enough to cause sudden dramatic nerve pain, but together over time, they change the terrain the nerves are living in. And nerves are exquisitely sensitive to their environment. Nerves need oxygen, they need blood flow, they need appropriate vitamin and minerals, amino acids, and stable energy. They need a nervous system that they can shift out of constant fight or flight. When those conditions slowly erode, nerve signaling changes, not suddenly, not randomly, but gradually. This is why so many people say, I can't point to one moment when it started, because often there wasn't one moment. It was slow, gradual, and sometimes an insidious onset. Another clue that nerve pain isn't random is how symptoms behave. If symptoms flare under stress, if they worsen at night, if they change with blood sugar, hormones, illness, or sleep, that's not randomness. That's regulation, or more accurately, dysregulation. It tells us the nervous system is struggling to maintain stability, meaning it's having difficulty keeping signals calm, consistent, and properly modulated in response to internal and external signals. And here's the most important part. This doesn't mean that your body is broken. It means your body has begun adapting for a long time to internal environment that stopped supporting healthy nerve function. Pain and altered sensation in this context aren't punishment, they're communication. They're the nervous system saying the environment I'm operating in is no longer supportive. When we shift the question from what's wrong with my nerves to what have my nerves been living through, well, everything changes. Because healing doesn't start with chasing symptoms, it starts with restoring the conditions nerves need to feel safe, nourished, and stable again. When we look at the nerve symptoms through the right lens, they finally can be understood. Now, if you want to learn how to actually repair nerves and reverse this condition, make sure you watch our video, Why Nerves Refuse to Heal. You'll gain enormous insight into the roadmap of your nerve healing and where you need to start. Health Warriors, if this video resonated with you, please like this video, subscribe to our channel, and share it with someone who needs to hear it. Don't forget to turn on notifications. We have a lot more clarity and guidance coming your way. I look forward to seeing you on the road to great nerve health.
You're a handsome boy. I love you.
We could leave him.
On film, he's so funny. You're so hysterical.